Welcome back once again. You're watching Ozarks Tonight. I'm David Oliver. You just heard my co-anchor in our previous segment there talking about the growing number of kids who are now vaping in our nation. Well, we're going to couple that with some more new information in regards to tobacco issues here in our state that just came out today from the American Cancer Society's Cancer Action Network. A new report is out, and it shows Missouri is falling short when it comes to tobacco control funding. We're going to get more information on this brand new information that's coming out today in this new report. We're joined tonight by Jerry Neville, who is the Missouri lead ambassador for the ACS's Cancer Action Network. Mr. Neville, thank you for being here. Explain to us, before we get into the information that's just out in this new report, what the Cancer Action Network is for the American Cancer Society.
Okay, we are an advocacy arm of the American Cancer Society. We're nonprofit, nonpartisan. We work with local, state, and federal legislators for passage of policy bills that can affect the health and well-being of the Missourians. We also contact our representatives on any type of funding that may be needed for certain programs, and most likely and most definitely research for finding a cure for cancer.
So you help do some lobbying, I guess you might say, and you mentioned before we went on the air that you do some work with Senators Josh Hawley and Roy Blunt as well. Let's talk about this new report that just came out literally today, August 1st, basically showing Missouri is falling behind and we're not living up to what some of the CDC recommendations are in terms of funding tobacco prevention in our state.
That's correct. There's a report that's called How Do You Measure Up? Is what it's titled. And this is the 17th year that the American Cancer Society Cancer Action Network has put this out. And it gives a ranking by state on how well they're doing on policy issues, mainly for access to care and prevention issues on cancer.
Okay, and it shows that we're not measuring up. Let's kind of go over some of the numbers here. I know we're not spending what perhaps we should be spending, according to some of the experts, on tobacco cessation programs and prevention programs, right?
That's correct. The CDC puts out information and a suggestion of what we should be spending for prevention and education, and we are less than 1% of the recommendation.
Okay.
So the programs could use some more definitely funding.
Obviously, I'm going to ask you why that is. The CAN, Cancer Action Network, is going to have an opinion perhaps that other people don't share, but why do you think that is, that we are falling behind in terms of that spending?
I think we need to do a better job of educating our legislatures on the effect that it has on the public.
Okay.
And I think the public themselves need to also contact their legislators and express their concern and what they would like to see done. There's a lot of bills that are competing, and we need to make sure that our message gets through.
Well, you just talked about legislators here in our state. How can the legislative actions and priorities of our lawmakers affect these cancer outcomes that we're talking about here in Missouri?
Anytime you have someone dealing with cancer, you have a huge cost involved when it comes to health care. For example, for people in Missouri, this year there will be 11,000 die just from smoking. There will be over 36,000 die from cancer in general. We'll spend over $3 billion on health care issues related to cancer. So if we can reduce the number of cancer victims, those people who have lost that battle, if we can get better preventive programs, better cessation programs on smoking, better health programs in general, we can also help reduce that health cost.
You know, I've lived here a long time. You've lived here since the 1970s, and I've always heard a lot, and perhaps you have too, Mr. Neville and others who are watching us tonight, about Missouri's smoking rates. We have some of the highest rates of smoking when it comes to adults in the nation, and you hear a lot of people talk as well about those tobacco taxes. We're one of the lowest in the nation in terms of the tobacco taxes. We've tried to raise those over the years. That's been voted down by the voters out there. How does that play into all this?
Very much. The cigarette tax on average nationwide is $1.81 per pack. In Missouri, it's 17 cents. So a lot of, we increased the funding for cancer research, for cancer education, for cessation programs by just raising the tax. A lot of things could be done that way. Unfortunately, the lobbyists on the other end also have their say into it, and it just hasn't happened yet. and it's even been voted down by the public. So unfortunately, we need to get that message out that if we want better health issues, if we want to solve this problem, we need to significantly raise our tax base. And plus, it's also recommended that we raise the minimum amount of money spent on cigarettes significantly by at least $1 at intervals. And so that we can get money that way also.
In terms of the Cancer Action Network that you're involved with for the American Cancer Society, what are your thoughts on vaping? We're seeing, as we just heard in our previous segment here on the broadcast, that we're seeing huge increases in young people who are vaping now, thinking that it's safe.
It is safer than smoking a cigarette,
Yeah.
but it's still not safe as such. The CDC has not put out any information on it yet. We're hoping that they will do that. We've asked them to do it, but so far they haven't. The rate for high school students is 10.8% and increasing.
Yeah.
Every year, it's the most widely used tobacco product right now.
Okay.
And without any kind of regulation on it, and the fact that it is not completely healthy, there are some concerns and issues there.
Well, we're not going to solve anything with this broadcast tonight, but perhaps we're going to start some dialogue, at least by your appearance here. If folks would like some more information, I'm going to put this up on the bottom of the screen here. It's a website. If folks would like to see this report about how we're doing in terms of how we measure up, what's the website? It's
www.fightcancer.org. And once you're in that site, you search for how do you measure up.
Okay, and like we said, it's not good news here in Missouri, according to the American Cancer Society's Cancer Action Network report that again just came out today, and you can find that, as Mr. Neville said, at fightcancer.org. Thank you for being here. I appreciate your input and your perspective. We'll have more Ozarks tonight after this quick break.